And welcome back. I'm Mabel John. You're watching day 2 coverage of our World Healthcare Congress in Washington, D.C. In our studio right now is Carolyn Ingram, who is VP for State Affairs at Molina Healthcare. Hi there, Carolyn. How are you?
Good. Thank you. Thank you for having me.
Well, tell me first of all, just give us an overview of what Molina Healthcare does.
So Molina provides a lot of different services, mostly focusing on members in our community who are on Medicaid, Medicare, or in other government-run programs. We have clinics throughout the United States. We participate running managed care programs, mostly focused on Medicaid, throughout the United States and in Puerto Rico. We also have Medicaid management information systems that we operate in states and the Virgin Islands. And we've grown quite a bit over the last few years. Molina's come from being kind of a small company really into a large organization, but has still kept its original mission, which is to really serve the more vulnerable populations. So we really focus on that and those folks that need us most. We do some exchange work now in states for when our members kind of move up out of Medicaid and move on to getting insurance through the exchanges in some states. We also provide that care, but mostly focused really on Medicaid and Medicare services.
Okay, and what do you attribute the growth to?
Really, a lot of it's been around the Medicaid expansion and states moving forward with expanding Medicaid to the adult population, but just also I think Medicaid, or Molina in general, focusing on its mission of trying to work and provide the most services we can for our members. So that includes not just the physical health services, but also their behavioral health. We've now started a new product called Pathways, where we're in 28 states actually on the ground delivering behavioral health care to members out there in the community. So sometimes that's outpatient services, sometimes it's inpatient care in the community, but we do have that bridge for our members where it's not just providing physical health, but their behavioral health. And then also what we call social determinants of health services, healthcare services. So things like looking at housing, or if it helps you to have some meals so you can stay at home, we also provide some of those services in that care.
And your community, the communities that you serve, are they responding well to some of the services that you've put out there in terms of it? People signing up for exchanges and all of the assistance that you've been giving to members of the community?
Yeah, I think so. I think people are seeing that managed care companies can help in states, not just to provide care to these vulnerable populations, but also to help keep the budgets in check when they need to. And as the Medicaid program's expanded in states, you've seen more and more people coming in with issues maybe around behavioral health or substance abuse, or as our population ages, people that really need services to be able to keep them in the community, such as meals or maybe transportation or home modifications to be able to, so that they can stay and live at home. And I think you're seeing more and more states who are primarily some of our customers and members who are some of our clients being able to access some of those care and services, and how important it is to offer that type of care.
Was Molina equipped to handle the growth?
I think so. I mean, we've had to obviously staff up, and one of the biggest things is to find people out there in those areas and those communities who really know how to work with folks that have some of these issues. And there's two ways that we do that. One is looking for people that have really worked on the Medicaid benefit package and design. Sometimes it's around the specific long-term care services. Another way we do that is really looking for people in the community who can work with us, and we have a program we call our Community Connectors program. That's when people go out into the community to help find our members, to really make sure they're getting the services they need to be able to stay healthy. And so we work in each of our states to locate those people. So in New Mexico, sometimes they might be called promotores, for example. In the Navajo area, we contract with the Navajo Nation's CHAs, so community health workers there that are actually individuals out working in the community with our members who are trusted people. They help build those relationships with our members so that they can help find them and help them get access to care and services.
What is the message that you want to leave with attendees during this meeting?
I think one of the big things that we talked about in this session was how important it is to really integrate care for people who are on Medicare and Medicaid, and what we can bring to the table in terms of outcomes for that. So if we really focus on coming in and finding those individuals, getting a healthcare assessment done, putting together a team, a coordinated collaborative team that really works for that member on behavioral health, on long-term care services they need. Sometimes it's around substance abuse. Sometimes it's just around housing and trying to figure out how to get them to be able to live in the community. We put that team together, and then we're able to dramatically reduce the costs once we get those services in place for those people. So it helps in multiple ways. It helps get the person in the community where they want to live, but it also helps the state in terms of reducing the cost of what they're spending on those individuals.
Okay, and we've had the pleasure of speaking with representatives from Molina over the past years. Why do you put this particular event on your calendar?
Oh, I think because it's a great opportunity to network with others and learn what's going on quickly in other states. You know, one of the things I think we all fall victim to is going back to our communities and kind of working. You put your blinders on, you're working really hard at getting everything done that you've got to finish for the day, and you forget to kind of look up and look around about what's going on. And so this activity and coming here allows me to network with people from different states, from different organizations, quickly go to sessions and pick up on innovation and things that people are doing so that I can kind of keep that focus on the bigger picture and not just get bogged down in my everyday tasks.
Absolutely,
So
right.
It's been helpful.
All right, Carolyn, thank you so much for your time.
Great, thank you. It's been nice speaking with you.
And I'm Mabel Jong. Thanks for watching. Stay tuned.